Brain injuries after trauma can be difficult to detect. Now, if somebody is severely injured in an accident and you can see their skull's crushed, there's a squirrel coming out of their head, I mean, just, ridiculous things. It's obvious there's severe brain damage and they need to get a hospital immediately. But in a lot of injuries, what happens is the brain is actually jarred, shaken, moved inside the skull, and the skull is still fine on the outside, but the brain is injured on the inside. And these are more difficult to detect. So if you or someone close to you has been in some sort of a situation where you think they may have brain injury, they need to get checked out really fast. Some of the symptoms to look for would be a headache that doesn't go away, nausea, vomiting, dizziness, confusion, memory loss, difficulty concentrating, changes in personality, changes in behavior, difficulty speaking maybe. So if you see these things after somebody's hit their head or maybe whiplash, something like that, make sure they get to a doctor quickly, because if somebody's brain has been injured and it starts to bleed inside, it'll create pressure that will cause damage to the brain cells, and the earlier you can get treatment, the better off the patient will be. Now, medical providers that come to a scene, they may initially use the Glasgow Coma Scale. It's a little bit different than what you'd see in a hospital. They check the person's ability to speak, to open their eyes, to move. And then when they get to the hospital, they'll generally use a CT scan, they'll use an MRI, try to look inside the brain and see what's actually going on. So the takeaway from this is, if you or someone close to you suffers a head trauma, get medical help sooner rather than later. Thanks for watching.